So we know that patients who have been exposed to either become resistant or intolerant to a covalent BTK inhibitor have got relatively limited options, but over recent years we've seen the advent of Venetoclax in that space as a phase 2 study of monotherapy showing efficacy. Interestingly, in the Murano trial, there are very few patients who've had a prior covalent BTK inhibitor, so it's difficult to use the Murano data set to really gauge the activity of Venetoclax-based therapy after a BTK inhibitor. But of course, the Bruin study investigated Pirtobrutinib in that space, and so there are a large number of patients who've received a prior covalent BTK inhibitor who have been exposed to and have responded well to Pirtobrutinib. So the open question, therefore, is which agent looks more active and safer in that context? Is it Pirtobrutinib or is it Venetoclax? And how should we sequence therapy after a covalent BTK inhibitor has been used and a patient has either become intolerant to it or resistant to it? And so the idea of this study is really to look at the patient cohort from Bruin and also the patient cohort from the phase 2 study that I mentioned, so from the Venetoclax study, and to do a matched adjusted indirect comparison between the two. Now, of course, this isn't a randomized trial, but the conclusions from this study is that progression-free survival looks fairly equivalent, but perhaps some toxicity measures look to be perhaps a bit better with Pirtobrutinib. And so this really just, I suppose, brings up the question more of when and if Pirtobrutinib is approved and licensed in this setting, whether you could use it before Venetoclax. And so that's the idea of this study.